Good afternoon. I'm Jenny Keane, the Chief Allied Health Professions Officer for Northern Ireland. The award for reform and rebuild of health and social care services post-COVID-19 attracted a large entry, and the three finalists are Rebuilding Public Health Nutrition in a Virtual World. This was an entry from the Northern Ireland Public Health Dietitians, and this project had a strong ethos of building community capacity and hit straight to the core of family and community isolation during the pandemic, as well as our emotional connection to food and sustenance. The next finalist, Maria Magukian, a speech and language therapist from Northern Health and Social Care Trust, with her project Transforming the Communicating with Children Early Language Intervention Programme. Maria successfully moved this programme to a virtual platform, and in doing so, built additional capacity, reduced costs, and increased efficiency. The service user feedback from families really impressed the judges in this entry. The next finalists are dietitians Sheila McVeigh and Julie McCullaghan from the Northern Health and Social Care Trust, with their project Reforming Dietetic-Led Celiac Services Response to the COVID-19 Pandemic. Sheila and Julia's passion and enthusiasm to ensure the best outcomes for their patients shone through, as did the high esteem this project has held within the wider gastroenterology multidisciplinary team. Best of luck, everyone.
Our project is all about how we transformed our parent carer programme, Communicating with Children, from a group teaching model to a virtual pathway to ensure safe delivery of the programme and maintenance of the service given COVID-19 restrictions. The new virtual pathway, designed with feedback from parents, takes a blended learning approach. So parents are provided with bite-sized videos that teach language support strategies, a booklet that summarises the information and supports learner engagement, a telephone call with a therapist for personalisation of strategies, and a follow-up assessment appointment, typically via Zoom. This virtual pathway really has enhanced the programme. An evaluation shows that all parents rated virtual communicating with children as useful to very useful. All parents achieved learning outcomes. All parents had shared the communicating with children training with significant others in the child's life and could do that easily via the virtual format. Parents have commented on the flexibility of the virtual pathway. Also, the virtual pathway allows us as therapists extra individualised time with families, allowing for a solution-focused coaching approach essentially to support transfer of learning and improved outcomes. With the virtual format, there's a 32% decrease in missed appointments and a 25% decrease in costs overall. The programme is all about empowering parents as their child's language facilitators. It's about doing that well by supporting parents' learning, and so it builds capacity. As a team, we've worked together to deliver this programme within weeks of a child being referred to the service.
Hi, my name is Julie McCackern, and along with me today is my colleague Sheila McVeigh. We are both specialist gastroenterology dietitians in the Northern Trust, and our project is around how we changed our dietetic-led celiac service as a result of the COVID-19 pandemic. When our service came to a standstill back in March 2020, we had to adapt our usual ways of working, and within a number of weeks we were back up and running again virtually. Our patients weren't keen on using Zoom, and so instead we recorded audio over our usual gluten-free presentation, and this was emailed out to all of our newly diagnosed patients ahead of their initial telephone appointment. We also found that annual reviews over the telephone were taking longer than we imagined, and our patients weren't really quite sure what to expect. This led to the development of a pre-clinic questionnaire, which was sent out with all appointment letters, and this helped guide our patients through their telephone consultation.
The presentation and questionnaire helped reduce the length of appointments for both new and review patients. We received very positive feedback, with 100% of service users finding the phone reviews useful, 80% liking the questionnaire, and 90% being happy with the telephone reviews if needed in the future. Going forward, we see virtual ways of working remaining an important part of our service. However, we do hope to be able to introduce a face-to-face aspect via Zoom group sessions or one-to-one appointments. And as always, we will continue to review and adapt the service in line with the needs of our patients.
I'm delighted to be able to announce the Public Health Dietitians Group Northern Ireland as the winner of this award. This is a good example of how dietetic services across health and social care are able to work collaboratively to support my department in the reform and rebuild of services post-COVID-19. It further recognises the impact that dietitians have in improving population health and in helping to address the social determinants of health. Congratulations also to Amy Jones, a physiotherapist from South Eastern Health and Social Care Trust, and Jill Stewart from the Northern Health and Social Care Trust, who have been recognised as rising stars.